This presentation provides an overview of the work that's been carried out so far in creating and developing two privacy-protecting total Welsh population electronic cohorts. The cohorts have been created to help understand the prevalence, determinants, and trajectories of multimorbidity and identify disease clusters causing the greatest healthcare burden and mortality. We have developed both prospective and retrospective focused e-cohorts to measure multimorbidity in Wales. Both e-cohorts utilise data held in the secure anonymised information linkage SAIL databank. SAIL is a comprehensive, privacy-protecting, linked data trusted research environment. It houses de-identified and encrypted health, demographic, administrative, and environmental data, and provides linkage at both the individual and household level to carry out large-scale observational studies. The prospective e-cohort, known as the WMC for short, contains all individuals alive and living in Wales on the 1st of January 2000, with follow-up until death, first migration out of Wales or break in Welsh residency, all followed up until cohort end date, which is the 31st of December 2019. WMC is part of the Health Data Research UK National Implementation Multimorbidity Resource Project. We want to be able to measure multimorbidity across the UK by bringing data together from 6 different research sites. These sites are based in all 4 nations within the UK, which has resulted in a considerable amount of work to harmonise datasets and create research-ready tables for analyst use. We have applied published comorbidity indices and phenotype code lists such as the Calibre Initiative, Charlson Comorbidity Index, Elix-Hauser Comorbidity Index, Common Mental Disorders, Global Burden of Disease Study, and the NHS Quality and Outcomes Framework to the available data to identify individual morbidities. Overall, there are 2.9 million individuals included in the WMC. Individuals are followed up for at least 1 day and potentially up to 20 years, resulting in 46 million years of follow-up available. This upset plot demonstrates the top 20 condition combinations recorded in either GP records or inpatient admissions using the Charlson Comorbidity Index for all WMC individuals. A diagnosis of pulmonary disease alone is the most common disease profile, with 309,599 individuals, followed by cancer. The most common conditions occurring together can be seen on the right-hand side of the slide. The second e-cohort we've been working on is the retrospective e-cohort, known as HHMM for short. This contains all individuals alive and living in Wales on the 24th of April 2018, with all unique households identified to explore clustering of multimorbidity within households. We have implemented 18 long-term NHS Quality and Outcome Framework conditions recorded in the GP data, going back to the NHS start date in 1948 and up to the 24th of April 2018, to measure disease prevalence and examine overall multimorbidity. This is a collaboration with colleagues in Queen's Mary, University of London, and has involved the harmonisation of data sets to compare 2 demographically diverse populations in Wales and North East London. Overall, there are 2.1 million individuals included in this cohort who are living in over 895,000 distinct households. This heat map demonstrates the average years of person follow-up by age, gender, area level deprivation of residency, and the number of quality and outcome framework conditions recorded. 13 years of follow-up have been calculated from the first GP recorded event up to the snapshot date of the 24th of April 2018. This upset plot demonstrates the top 20 condition combinations recorded in B records. These are the 18 QOF conditions for all HHMM individuals. A diagnosis of obesity alone is the most common disease profile with 166,021 individuals, followed by depression. As shown, obesity and depression are the most common conditions occurring together. The 2E cohorts have been created to provide a platform to support research to further the understanding of multimorbidity. Both E-cohorts have been created as part of the collaborations with organisations across the UK and under Health Data Research UK. Further work will include applying statistical and machine learning approaches to identify clusters of disease prevalence, as well as the prevalence of multimorbidity, and measure the impact of multimorbidity on health outcomes and healthcare utilisation. This work has been funded by HDR UK, Medical Research Council and the Alan Turing Institute. Thank you very much for your time to listen to this presentation. Please feel free to send any questions to me by email.